It's very important when speaking with patients that they understand there are many different types of lymphoma. At least 20 different common types of lymphoma, and each of them is evaluated differently, treated differently, followed differently. And when patients go to the internet, for example, for information about lymphoma, they may be reading about the totally different type of lymphoma than the type that they have. So we start by telling them about the type of lymphoma that they have, what its relationship is to other types of lymphomas, how we evaluate it, that is, with x-rays or scans or additional biopsies. Hi, Ms. Kennedy. Hi. I'm Dr. Hoppy.
Nice to meet you.
This is Mia, my nurse.
I'm Mia. I'm Dr. Hoppy's nurse coordinator. Nice to meet you.
The first step in your care is a consultation. You'll meet with a doctor who specializes in the use of radiation to treat cancer. You'll also meet the team who will support you throughout your visits. Your doctor will discuss your diagnosis and your current and overall health. Your doctor may also ask about your family history, prior illnesses, and lifestyle, whether you smoke, for example, or how much you exercise. Then, together, you and your care team will decide on the approach to your care. The consult is an opportunity for you to share any concerns and to ask any questions. It also is the important opportunity to call attention to all of the medications you take, even occasionally. Some prescription medications, vitamins, supplements, and herbal remedies can affect how your body responds to radiation therapy. Lymphomas may be treated with medications that work throughout your body, like chemotherapy, or with radiation therapy, or some combination of those treatments. This video is about treating lymphomas with radiation therapy, which is a form of high-dose X-ray. Radiation therapy may be used alone or in combination with chemotherapy. At Stanford Health Care, the type of radiation typically used to treat lymphoma is referred to as external beam therapy. It uses a machine to deliver a beam of radiation from outside the body into the cancer. The machine moves around your body, but it never touches you. The radiation beam is like an X-ray. You won't feel anything, and it doesn't make you radioactive. The goal of radiation therapy is to kill the cancer without harming your surrounding healthy tissues.
What we'll have you do is lay down, your head will go here, your feet will go there.
When you and your care team decide to proceed with radiation therapy, you'll come in for an appointment simulation, which is the first step in preparing for your actual treatments. Depending on the location of your lymphoma, we'll make a cushion that's customized to fit only you to ensure that you're cradled in the same position for every treatment. Our therapist may lightly tattoo or draw marks on your skin to help ensure that you're properly positioned for each treatment. We will then use a CT scan, PET scan, or MRI to create an image of the area that we'll be treating. This scan will be used to plan your treatment and to identify the areas to target. If your cancer is in the chest, your treatment plan will consider how your tumor may move as you breathe. Measurements will be taken during simulation to guide instructions to you about your breathing during treatment. After simulation, your radiation oncology team will take about 1 week to create your personalized treatment plan. A person trained in treatment planning, called a medical dosimetrist, will work with your doctor to design a treatment plan. A medical physicist will review and confirm that the treatment plan is as prescribed. Typically, you'll be treated once a day, Monday through Friday, over the course of several weeks. The exact number of treatments will depend on the type and location of your cancer. Most of each appointment is spent getting your body positioned correctly. The actual radiation treatment lasts just a few minutes. Usually, you'll be in our department for about 15 to 20 minutes for each visit.
Here we go with treatment.
The radiation therapist will then go into another room, but will be able to see and communicate with you through a speaker system to let you know when the radiation will start. At least once a week, your radiation oncology team will meet with you to discuss your progress and any side effects you may have. But your care team is available to you anytime during your treatment and follow-up. Side effects of radiation therapy vary from person to person. You may feel mild fatigue. You may experience a mild nausea after the first few treatments, but that usually goes away. If treatment is delivered near the neck, you may develop a sore throat. If treatment is delivered to your chest, you may develop a dry cough. You may develop skin irritation, like a sunburn. If treatment is administered to the stomach area or pelvis, you may experience mild indigestions and looser or more frequent bowel movements.
It's very rewarding to us. And what is extremely rewarding is when we see patients who come back in long-term follow-up who are doing well, and that's what keeps me coming to work.
Your care doesn't stop after treatment. Your care team will schedule follow-up appointments to see how you're doing and provide any additional imaging or care you may need. If you've had a doctor for chemotherapy, that doctor will be included in your follow-up care. Your team at Stanford Radiation Oncology is always here to support you.